Welcome to Central News, I'm Hilary Entwistle. In today's news, following the recent epidemic of whooping cough, the government is now funding the vaccine for all women who are 28 weeks to 38 weeks pregnant. There have been 6,700 notified cases of whooping cough since August last year, of which over 200 were babies under 1 year of age who required hospital treatment. Health Minister Tony Ryall says international research shows the most effective way to protect babies before they are immunised is to vaccinate the mother during pregnancy, so antibodies are passed on to the baby. Medical Officer of Health for Bay of Plenty's Toitū Ora Public Health, Dr Phil Shumack, says funding of this vaccine is a great step towards stopping the epidemic.
Well, we're fortunate that Pharmax decided that the vaccine should be available to all women during pregnancy since the 1st of January.
The warmer and drier summer this year has meant a very busy season for Surf Lifesaving New Zealand. Papamoa lifeguards carried out 37 rescues in the first week of this year, which is well over the 28 they did the whole of last year. Club Development Officer for the Bay of Plenty, Scott Bicknell, says when people swim between the flags, this always makes lifeguards' jobs easier.
Well, first and foremost, make sure you swim between the flags, and secondly, make sure you listen to them when they instruct you to go where you need to go, and just be aware of the beach conditions and that they can change quite rapidly.
A 10% increase to the price of cigarettes has seen an increase in the amount of people choosing to quit this year. Smoke-Free Hospital Coordinator for Tauranga Hospital, Sue Freeman, says the new year is a great time to make goals to quit smoking, and the price increase has seen patients use this as an incentive.
Yes, we've had some research done and the patients are definitely quitting because of the price increases. It is the main driver of their quit attempts.
To help New Zealand businesses get more employees in the saddle, the New Zealand Transport Agency has launched a new set of free Bikewise resources. The resources include guides on running in-house cycle events, tips on cycle safety, the health, financial and sustainable benefits of cycling, and helpful suggestions on how to improve workplace cycling facilities and develop a cycle plan to engage staff. The NZTA's Network User Behavioural Manager, Jeannie Ganotti, says encouraging staff to cycle to work, take lunchtime cycle breaks or participate in company-wide cycling events can benefit the individual as well as the workplace. Restrictions banning campfires, bonfires and household and garden rubbish fires are being imposed by the Western Bay Moana Rural Fire Authority. Escalating fire danger levels in the Western Bay of Plenty are in the very high to extreme range, prompting the restrictions on fire permits issued. The action is short of a total fire ban, says Principal Rural Fire Officer Barry Lowe. However, no permits will be issued for fires that are not considered absolutely necessary. A new service is helping high-risk victims of domestic abuse feel safer in their Tauranga homes. The initiative, brought to Tauranga for the first time by Shine Safe at Home, is a crime prevention program that implements measures to make victims' homes safer. A Tauranga mother who wishes not to be identified is the first woman to receive the home security upgrade. The woman is identified as a high-risk victim of domestic violence as she comes from a violent relationship and is continuing to be terrorised by her ex-partner. Shine Safe at Home has now installed security lights at the woman's home and helped her with a risk assessment and safety plan to help keep her and her children safe. Now for our region's weather. Hamilton fine with light winds, your expected high is 27 and an overnight low of 11. Friday for you, Tauranga, is fine with a southeasterly breeze, your expected high is 25 and an overnight low of 14. Just ahead, the rise of third world diseases in our regions. Welcome to Central News on TV Central. In the last 20 years, there has been an increase of 51% in hospital admissions for infectious third world diseases in New Zealand. Many are blaming damp housing, poverty and a lack of primary health care for the rise. I spoke with the Western Bay of Plenty's primary health organisation, Toitū Ora, to see if they are on the rise in the region.
We haven't seen an increase, but some of them are proving to be quite resistant to our efforts to reduce them. Rheumatic fever is a very good example, where rates of rheumatic fever in parts of New Zealand, including the Bay of Plenty, are at as high levels as they are found in some third world countries.
One of these diseases is rheumatic fever. This can leave permanent damage to the heart and can be life-threatening. What are the symptoms and how does it actually start?
Okay, well, rheumatic fever is a result of the body's reaction to a common bacterial throat infection caused by what's called a strep bug, strep sore throat. For reasons we don't quite understand, the body's immune system reacts to that infection in a small proportion of people who get a sore throat. And as you said, that leads to potential life-threatening damage to their heart. Why it's so common in parts of New Zealand and parts of the Bay of Plenty, we don't know.
There has also been an increase in meningococcal disease. This can also be quite life-threatening. What are the symptoms there?
Yeah, well, meningococcal disease is a problem which we'll never get rid of. It's caused by a bacteria which affects particularly the brain, but can cause blood poisoning and therefore general symptoms. And the symptoms can include anything from a sore throat, a really bad fever, severe headache, not liking bright lights, vomiting, and drowsiness. And it's very difficult because a lot of those symptoms are not too unusual or too dissimilar to what you might get with influenza. The thing with meningococcal disease that's slightly different is that they tend to come on very, very rapidly. New Zealand's had a significant epidemic of meningococcal disease through the 90s into the early 2000s. We've actually got down to a level now where the number of cases is almost back to what it was 20 years ago, before we had that epidemic. So we haven't had an increase in recent years, but it certainly hasn't gone away, and it won't do. So people do need to remain vigilant.
Skin infections are on the rise. What are the symptoms there and what are the different ones?
Yeah, well, it's interesting because skin infections, there's a lot of similarities in the causes, both in terms of the bugs that cause them, but also the background to it, as you get with rheumatic fever. So the strep bug is one of the bugs that causes these skin infections. Another one's called staph, and they're often called school sores. Particular problems with children, they often end up getting quite severe infections and have to be admitted to hospital. And in general, the sort of things that we're looking to make a difference to in order to lower the rates are to improve general hygiene, starting with basic things like hand washing.
With the cases that you have seen in the Bay of Plenty, are they directly related to poverty or damp housing or poor access to primary health care?
Yeah, well, it's interesting because the things you mentioned are related to lots of health problems, particularly in children. And yes, rheumatic fever, skin infections, chest infections in children are related to those things. It's not that being poor necessarily causes them, but it does mean that you're more likely to experience problems. And similarly, if your house is damp or if your house is not adequately heated in winter, it does raise the possibility of, in particular, children getting unwell.
Māori and Pacific Island people are more than twice as likely to be hospitalised with one of these diseases. Is that the case in the Bay of Plenty as well?
Well, yes, with skin infections, the rate is about double. With rheumatic fever, it's more like 10 times. So rheumatic fever is almost unheard of in Pākehā children. It's a problem in New Zealand that is pretty much unique to Māori and Pacific children. And again, we don't really understand why that is.
And so there's really no understanding why Māori and Pacific Island people are more susceptible?
Well, some of it's related to the issues that you've mentioned, housing, access to healthcare, poverty, but that doesn't explain all of it.
How should we try to avoid contracting those diseases?
Our major campaign at the moment to try and tackle them is to raise community awareness, and so this sort of conversation certainly helps. And part of the message is that if you've got a child who you think is suffering from one of these conditions, don't hesitate to get in touch with your doctor. And then we're also organising education programs with doctors and nurses as well to make sure that they're attuned to recognising the problems and provide the appropriate treatment.
And so if we do suspect that our child or ourselves are infected, we should go to the doctor?
Yeah. That's the first port of call, yes.
What if we can't afford to go to the doctor?
With children under the age of 6 now, primary care is free at the point of use, and most practices have a a relatively low charge for children of older age group, school age. But yeah, access to care, one of the limiting factors is cost, unfortunately.
Stay tuned, as up next we find out what there is to do this summer in Hamilton. Welcome back. Stuck for family-friendly ideas over those summer weekends? Summer in Garden Place has got you sorted with a whole lineup of entertaining days. Amy spoke with two of the organisers to find out more.
Michelle, tell us about Summer in Garden Place and how it came about.
Sure, so Summer in Garden Place is a program started by Hamilton City Council 4 summers ago to consciously bring events and activities into Garden Place, and that was around the same time that we redesigned and changed the layout of the space to what we have today. So Hamilton City Council has invested significantly in Garden Place over recent years, and we're really keen to see this place develop further as a focal area in the city for community events.
Now, Rangi, you have had a few events so far. How's it been going, and have you had good numbers?
Yeah, it's been great. We've had a really good attendance, especially at our Christmas Carnival in December, and also at our Toy Trade Fair, which was just last Saturday actually. Hundreds of people turn out, and the weather's been great. I think we've only had to cancel one Friday lunchtime music session due to a bit of rain. So other than that, it's been really good weather and really great turnout.
So Michelle, over the next couple of months you've got a few events coming up. Can you tell me a bit about each of these events?
Sure. So this Saturday we have our second carnival. It's happening on the 26th of January, and that's our superhero carnival. It's the first time we've had one like this. There's so much to do. We've got Batman and his arch nemesis, the Joker, in costume. They'll be roving around for the day. We've got Captain Jack Sparrow giving out balloon swords. We've got some great performances on stage. We have Mr. Roborelli, a kids band, and also an American performer, Andy Mason. Free face painting, a toddler's play area for the under 5s, free sausage sizzles, and we've got some local karate and gymnastics clubs coming to do some displays. We've got a competition for the best dressed kid on the day. We'll be having a photo booth set up for free where you can take away a strip of pictures from the day, as well as loads of inflatables. That's our hallmark at all our events. So that carnival is happening this Saturday. The next event after that is a couple of outdoor performances as part of the Sky City Country Music Weekend, which is Saturday the 2nd and Sunday the 3rd of February. The next one is really cool actually. I can tell your viewers that we've got the Vodafone Warriors in Garden Place on Friday the 15th of February. They'll be doing photos and signing any Vodafone Warriors merchandise that people want to bring along. They'll be here at lunchtime, and that's pretty exciting. It's the day before their big match against the Panthers. So the next event that follows that is another kids carnival. They're a real feature of summer. So we've got the Children's Day Carnival happening on Saturday the 23rd of Feb. That one's really cool. It's the day of the year where the whole country stops and recognises kids and values them for who they are. Families can come down and enjoy a heap of activities. And that one is run in collaboration with the libraries for the city and also the museum. So they've set up a cool discovery trail down Victoria Street, which will be fun. So moving into March, the next big event is the Chinese Lantern Festival on Friday the 1st of March. That's going to be spectacular to see lanterns lit and set off here in the space. And people can also enjoy cultural performances, dances and ethnic food stalls on the night, which will be great. The next event is the Ulysses Tour Run for Cancer. So they ride in on their motorbikes to Garden Place on Sunday the 3rd of March. They'll be really loud, really fun, and a great event that we've enjoyed supporting over the years. And then we move towards the end of the program. We have our finale carnival happening on Saturday the 30th of March. It's a twilight carnival this year, and so people can enjoy all the elements of our usual carnivals for kids, inflatables and rides and so on, but we'll also have fairy lights strung up and some market stalls to enjoy, and we'll also celebrate Earth Hour where we switch out all the lights.
So Rangi, whereabouts are these events located?
Well, they're all located here in the heart of Hamilton, Garden Place, right by the shared zone that connects Worley and Alexandra. We've got a great covered stage, grass area that you can sit on, get some shade underneath the trees, a water fountain that can cool you off, and also great eateries and retailers that look onto the space.
And who can come along to these events?
Well, anybody can come along. Everyone's welcome. There's something to do for everyone at all the carnivals and everything that's going on in Garden Place over the summertime. Generally, though, we get a lot of families turn out because they are, aimed at children and things like that. And there's a lot of fun things to do, but most importantly, they're all free. So
now, Michelle, why do you think there is such a need for family-friendly events over this time of year?
Well, I think summer is a time of year when families are looking to plan lots of things for the whole family to enjoy together, and we try to plan a diverse program so that parents can plan a real action-packed summer for the kids. And as Rangi mentioned, everything being free, it's just such a bonus for families because summer and Christmas can be a costly time of year.
And how much work goes into organising each of these events?
Lots of work goes in behind the scenes. The program runs from December till March, but months ahead of that we're sitting down and planning what we will run and which events were successful. We work with a lot of partner organisations and it really just couldn't happen on the day without their help, and volunteers are a huge part of all the events that we have here.
So who are the events sponsored by?
So a lot of the events are led by Hamilton City Council, such as all the kids' carnivals and also the Friday lunchtime live music. But we've worked quite hard this year to attract other events to the space as well, and some of those events are run by external groups completely separate to council, such as Indigo Festival, the Chinese Lantern Festival and the Real Free Party. And on our own events even, we've worked hard to try and bring in partners. So we've worked a lot this year with Free FM and also with Te Ahurea Rangatahi, one of our local youth providers. And a key partner to the whole program this year has been the Hamilton Central Business Association, who've done a great job of promoting every event that we've had, and they've even sponsored large parts of the program.
Just ahead, the triathlon events around the Mount. If you have just joined us, welcome to Central News. Mount Maunganui is a popular spot not just for beachgoers and holiday makers, but for the elite athlete. There is a range of ocean swims, duathlons, triathlons and Ironmans held every summer in the Mount. I spoke with one of the organisers to find out more and what the next one is coming up.
Surfbreaker Triathlon it's a normal triathlon, so it's a swim, bike, run, but the point of difference is that it's in the surf. So rather than doing it in a dead flat Pilot Bay, or even today in slightly choppy, then there's a chance of a wave.
So what are the different distances that we can actually compete in?
At the Surfbreaker Triathlon we have offered this year 3 distances. So a sprint triathlon, which is around about a 700 metre swim, 16k cycle and a 5k run. Super sprint, which is half of all of that, and a duathlon, which has a short run, the 16k cycle and a 5k run at the end.
And how many years has this event been going for?
I think it's 28 years. So it's been around for a long time. It was one of the original triathlons.
Why is the Mount such a popular spot for sporting events like this?
Just look at it. It's the most beautiful place. The geography, just neat locations, for the most part supportive population, council supportive of what we do, and where else would you want to be?
Is it because we've got a nice flat road for the kind of the cycling and running types next to the ocean?
The flatness isn't the issue by itself, but yeah, it is conducive to nice straight lines and being able to measure 16k's from here to there.
And how many people have you actually had competing in previous years?
Surfbreaker Triathlon in its heyday was about 350 to 400 participants. Latterly, over 200 is a really good number. This year we just on hit 200, so not too bad.
Now, just recently you did have the 30th anniversary of the Around the Mount swim. How did that go?
Really well, really well. The weather was perfect, conditions were great. We took a little bit of a risk and had it on a slightly different tide to what we normally do, but it made no difference at all to the swimming times. So the fastest time was the same, the slowest times were the same. 211 starters. It was awesome.
Now, Shorebreak Aquatics actually does open water swimming coaching. How different is swimming in the open water to swimming in a pool?
You need to think a lot more. And what we try to do in our open water coaching program is to focus on decision making and problem solving. So even when we come down here to Pilot Bay, every day is different. So the conditions are never the same, the tide's never exactly the same as it was last time. Today, for instance, is a little bit windier than normal, but it's a wind that's coming straight onto the beach. So just figuring out how to compensate and how to cope with things that the open environment throws at you.
And what are some tips to deal with that different environmental factor?
Look, to be honest, the way you learn to cope with the environment is to come and be in the environment. You have to come and practice. You have to come and say, well, okay, today this is what we've got, so this is what I'm going to learn to cope with. Come back tomorrow and it'll be different, and right, okay, well, how do I deal with today's situation?
You are one of only 73 individuals to actually complete the Cook Strait open water swim. You did it in 6 hours, 59 minutes in 1982. Is that one of the hardest swims that you've actually ever done?
Look, like most things, it's about preparation. So I had a good team around me. We'd done the physical work, we'd done the open water work. So the swim itself was not the hardest part. The hardest part was getting in and doing those 6 or 7 hour training swims in Wellington Harbour, and finding the support crews and all the people to help with all of that. But once the preparation's done, it's like anything. If you're properly prepared for it, then, and I'd never say it was easy, but you can control the things you can control anyway, and your chances of it happening are far greater.
A lot of these triathlon events actually involve the road closures. Are most of the public in favour of these?
Yeah, for the most part, and really any issues that we have with them are really because someone hasn't read something properly or misunderstood something, or so it really just takes a phone call and an explanation and everything's fine. But I would say 99.9% of the time our public actually enjoy having events here. They get out and stand on the side of the road and encourage the competitors and do all those sorts of things. So yep, we get really good support.
I mean, it can be quite a good community event, can't it, when you actually go out there and see all the supporters?
Yeah, absolutely. Yeah. No, it's neat. Neighbours actually talk to each other, which is quite cool.
It is probably a little bit late to start training for some of these events that are coming up on the 28th and the 3rd of March. If we wanted to compete next year, what are some good training tips?
Look, I don't think that it is too late. Someone who's normally fit and healthy and does a little bit of running and cycling, particularly the super sprint distance, which is a race that for an average person might take 35 to 40 minutes. So that's actually quite manageable on not a lot of specific training. But if you want to get involved in triathlon on a long-term basis, then give us a yell. We'll give you some helping hints.
The East Pilot Bay Classic is on this long weekend, Monday the 28th. That is the news for today. We really want you to be involved, so like us on Facebook and let us know your views. If you have news including your own video and photos, go to our website and hit upload. Thanks for joining us. I will be back tomorrow night with more guests from in and around the regions. I'm Hilary Entwistle. Have a lovely evening.
This has been an Alpha Media production, a division of Television Media Group.
Supporting local content so you can see more of New Zealand on air.